Hi everyone, this is Sandy, midwife lactation consultant with My Mom Glow. Today I want to talk about some of the tests that are typically offered for babies after they are born. A lot of times I've had parents that are, preparing for the birth of the baby, they're preparing with supplies, they're preparing for breastfeeding, but what happens after the baby is born is what I usually hear. And so they're not always prepared for that. And it's really important to know what the common things are so that you understand what questions you need to ask your provider, if any, and also making sure that you can give informed consent to whatever it is that needs to be done. So we have our beautiful birth, and after those precious moments of skin to skin and bonding, there's just a few routine things that happen. So immediately after birth, in an out of hospital setting, we as midwives typically do a pulse ox, and the pulse ox is to check the baby's oxygen saturation. It can also detect if there's any congenital heart defects, so we want to see that their O2 stats are 95 or above within 10 minutes, and then if they're not, then that can indicate something else, and maybe we can go somewhere else to get it checked out. Maybe we can see the pediatrician sooner. In the hospital, they pretty much do the same thing. I would say initially in the hospital, they want to do like all of the tests, like all the weighing and the measuring and, and everything like right after birth. However, I always recommend let's try to honor that golden hour and allow the baby to stay skin to skin. So we should really try to talk to the provider that you have and ensure that they honor this. It's really important to help regulate baby's temperature, breathing, and even their blood sugar just by having them skin to skin. So we want to try to delay a lot of these tests. They can do the pulse ox while the baby is skin to skin. They can listen to the baby's respirations. They can listen to the heart tones. They can take the temperature. They can do all of those normal vital signs while you and baby are still connected. So that's the initial test and routine after birth. So the next thing would be the newborn screening. Now, the newborn screening is also known in some places as the heel stick test, or years ago they used to call it the PKU test. But basically what they're doing is they're taking a few drops of blood, which is right here on the top. So your baby has to get a heel prick on the side of the heel, and we have to drop 7 drops onto this card. Okay, so this paper card has to be soaked. And the reason why they do this, and they typically will do it within the first couple of days, it really looks for dozens of different rare but serious metabolic and genetic or even hormonal issues or blood disorders. So most babies have completely normal results, but when a condition is notated or found in the newborn screening, it's something that can be identified early and can be treated early. And in some cases can be really addressed in an earlier time to prevent further complications or illness later on down the line. So that's definitely one of the things that they recommend. The other thing that is recommended is the newborn hearing screening. Now, it's a quick test that's usually done while the baby is sleeping and resting. We want to have it very quiet so that the baby's not reactive to other sounds, so that it really can zone into the sound of the earpiece. So what's in the earpiece is very soft sounds. The equipment measures how the baby's ears respond to those sounds. And early detection of hearing loss allows families to begin interventions sooner, which can be incredibly important for speech and language development later on in life. So another important screening is checking the baby's bilirubin. So they do this typically within the first few days as well. It's another heel prick. And I would say when they're doing the newborn screening, they probably are checking that too. Just depends on your setting and your provider. If you're in the hospital, they might be doing it. But bilirubin is a natural substance that's produced when red blood cells break down. So many of the newborns develop some degree of jaundice, which is when the skin turns yellow, sometimes even on the white of the eyes. And, the bilirubin screens to see what number it is, right? Like Is it 11, 12, 13, 14? Anything over that is really high and can be very dangerous. Now, as a preventative, I tell all of my moms, you want to try to put the baby in the sun 2 times a day, once in the morning, once in the afternoon. I'm in Florida, so we have really harsh, hot sun. So typically I recommend before 9 in the morning and after 4, maybe 5. So when the sun is not so harsh. And basically they're gonna hold the baby facing up, cover their eyes, so covering their eyes facing upwards, just in a diaper or naked, and then turn them down, facing down. So 5 minutes facing up and then 5 minutes facing down. And that is the best way to help, right? The vitamin D helps to like eliminate some of the bilirubin. And you know, depending on the baby situation, they may continue to do it if it's higher than normal. And in some cases, if it's really severe, they're gonna recommend phototherapy, which with ultraviolet light. But the best ultraviolet light we have is our sun. So that's why we try to encourage moms to do this as a preventative method, so we don't get to that point. But you know, it's important that we check it, because we want to ensure that the baby is not going to have high jaundice levels, which can you know, cause some pretty serious illness and issues later on down the line. So those are pretty much the main ones. You know, if you're in an out of hospital setting, midwife will typically want you to go to the pediatrician within the first week, just so that there's a once over by them as well. Midwives are fully trained to care for mothers and babies for up to 6 weeks postpartum, and we are monitoring both mom and baby. But it's always nice to establish that relationship with the pediatrician, so that if there is anything that presents, you already know where you're going to go and you already feel comfortable with that person. The other thing I'll recommend is later on in the pregnancy, you want to start figuring out what pediatrician you are actually going to go with, because it's really difficult to just choose a random pediatrician and you're sitting in their office and now they're saying things that need to happen that you're not comfortable with. You want to ensure that you can ask them questions prior to, you know, having the baby. Are you okay with this? I'm choosing not to do this, or I would like to do this. I'm having an out of hospital birth, or I'm having this, or whatever it is, and see what their views are, because you want to feel aligned with that provider that is going to be taking care of your child. The worst thing is feeling vulnerable with a brand new baby that, let's say, you need to, you know, go to the doctors for, and now you have a doctor that you don't feel comfortable with or you do not feel aligned with. That can be very stressful for the family. So I would say start interviewing. A lot of pediatricians will offer either Zoom or group interviews where you can go and ask questions, or you can just schedule a private interview with them ahead of time and have a list of questions and things that you want to go over before the baby arrives. So the more you understand what to expect during this time, the more confident you'll feel welcoming your new baby into the world. So, you know, if you're experiencing any confusion with what's going to happen, or how are things done, I would highly recommend that you sit down, talk with your provider, make sure that you read and look at evidence-based research and make informed choices, because now when your baby is born, there's going to be a lot of decisions to be made. So you want to make sure that when you're making those decisions, you are making them from the best part of your confidence and the research that you've done, and because you know what's best for your baby. So if you have any questions, please post them in the comments. I'd love to hear from you. Please follow and subscribe. Thanks. See you in the next one.